My name's Todd Magnuson. I'm one of the ears, nose, and throat doctors here at St. Cloud ENT. And if you're watching this particular video, your doctor has decided that you have a lesion or something on your ears, nose, throat, head and neck region that needs to be removed, either to be sent for biopsy to the pathology department to see what it is, or if it's a cyst or lump that is bothersome, it can be removed, and then you can have less annoyances with that area. Typically when people come in, they'll come in and we have a procedure room in the back that you'll go to, and then it's a matter of prepping that area and then injecting some anesthetic in that area, letting it sit for a few minutes, and then after there's adequate numbing as well as constricting of the blood vessels so there's less oozing, then we make an incision and remove the lesion. We try, especially if there is a concern about the pathology, to get a margin of normal tissue surrounding that lesion excised so that you'll have less likely chance of needing a recurrence. And that's why we send it to the laboratory to make sure that the margins are clear. Once we know that, then we can safely follow that lesion or incision site. The other thing that we do is that when we're closing the incision, we typically use suture material that absorbs, and so there won't be any need for suture removal. Sometimes we'll use absorbable stitches for the deeper part to hold the lower borders of the skin together, and we may use a light stitch that is removed. And if there is a stitch or stitches that need to be removed, we'll usually have people come back around 1 week to 2 weeks afterwards. And then at that time we can review the pathology if the pathology was sent, or at the very least to make sure that the wound is healing adequately. Typically lesion excisions don't take too long. I would suspect anywhere from 20 minutes to sometimes 30 minutes total. But again, people are able to walk in, have the procedure, and then leave and drive themselves to work or home and resume normal activity that day.